You slept last night, you got through the morning, but by the afternoon, your energy was gone again. Maybe you blamed your schedule, your age, or the fact that you did not drink enough coffee. But if you feel tired most days, the reason may be more complicated than simply needing more caffeine. Welcome to Health for Legacy. In this video, we are looking at 7 common reasons people feel tired all the time, the clues that may point toward each one, and what may actually help. This video is for general education. It cannot diagnose the reason you feel tired. Fatigue is a symptom, not a disease, and the right solution depends on the cause. Before we begin, there is one useful distinction. Sleepiness means you feel as though you could fall asleep. Fatigue is broader. You may feel physically drained, mentally slow, unmotivated, or unable to do what you normally do, even when you're not about to fall asleep. Now, let's begin with the most obvious cause, which is also one of the most overlooked. Number 1, you are not getting enough sleep or your schedule is too inconsistent. Most adults need at least 7 hours of sleep, and many need somewhere between 7 and 9 hours. But time in bed is not always the same as time asleep. If you go to bed late, wake up early, sleep much longer on weekends, or change your schedule from day to day, your body may never settle into a stable rhythm. You may notice that you depend heavily on an alarm, struggle to get moving in the morning, feel sleepy during quiet moments, or need far more sleep on your days off. So, what may help? For the next 2 weeks, give yourself a real opportunity to sleep. Keep your wake-up time as consistent as possible, even on weekends. Work backward from that time, and allow enough room for 7 to 9 hours of sleep. Keep your bedroom cool, dark, and quiet. Reduce bright light and heavy meals close to bedtime. And remember, caffeine can remain in your system for hours. If you are sensitive to it, an afternoon coffee may still affect your sleep that night. Number 2, you are sleeping, but the quality of that sleep is poor. Someone can spend 8 hours in bed and still wake up exhausted. One possible reason is sleep apnea. Sleep apnea happens when breathing repeatedly stops or becomes restricted during sleep. Your brain may have to keep pulling you out of deeper sleep so that breathing can restart. You may not remember waking up, but your sleep can become broken and unrefreshing. Possible clues include loud snoring, gasping or choking during sleep, morning headaches, a dry mouth, trouble concentrating, and significant daytime sleepiness. Not everyone who snores has sleep apnea, and not everyone with sleep apnea knows that they snore. If these signs sound familiar, especially if another person has noticed pauses in your breathing, speak with a qualified healthcare professional. A sleep study may be needed. A better pillow, a supplement, or simply going to bed earlier will not correct untreated sleep apnea. Number 3, stress, anxiety, or depression may be draining your energy. Mental health affects the body. When your mind stays on alert, sleep may become lighter, muscles may remain tense, and ordinary tasks can begin to feel harder. Depression does not always look like constant sadness. It can show up as low energy, feeling slowed down, losing interest in things you normally enjoy, changes in sleep or appetite, and difficulty concentrating. Anxiety can also leave you exhausted, especially when worry follows you throughout the day and into the night. What may help depends on what is happening. Regular movement, a more realistic schedule, social support, and relaxation practices may help some people. But persistent symptoms may require professional support such as therapy, medication, or a combination of treatments. If you have lost interest in things you normally enjoy, feel hopeless, or are struggling to function, do not dismiss it as laziness. Talk with a healthcare professional. And if you are thinking about harming yourself, seek immediate help. In the United States, you can call or text 988 to reach the Suicide and Crisis Lifeline. Number 4, you may have iron deficiency or anemia. Red blood cells help carry oxygen throughout the body. When you do not have enough healthy red blood cells, or when your body does not have enough iron to produce them properly, tiredness and weakness can follow. Other possible clues include shortness of breath during normal activity, dizziness, headaches, pale skin, cold hands and feet, or a fast heartbeat. The risk may be higher with heavy menstrual bleeding, pregnancy, blood loss from the digestive system, certain eating patterns, or problems absorbing nutrients. Here is the important part. Do not assume that fatigue means you need an iron supplement. Too much iron can be harmful, and not every type of anemia is caused by low iron. A healthcare professional may use blood tests, such as a complete blood count and iron-related tests, to determine what is actually happening. Treat the deficiency if it is confirmed. Do not guess. Number 5. Thyroid or blood sugar problems may be involved. The thyroid helps regulate how your body uses energy. When it is underactive, fatigue can appear along with feeling unusually cold, constipation, dry skin, weight gain, muscle aches, or changes in menstrual periods. Blood sugar problems can also affect energy. Diabetes may cause fatigue along with increased thirst, frequent urination, blurry vision, unusual hunger, slow healing sores, or repeated infections. These symptoms do not prove that you have a thyroid condition or diabetes. Many of them can have other causes. But if fatigue continues, especially when several of these signs appear together, ask a healthcare professional whether testing makes sense. This is another reason random supplements are not a good first response. You cannot reliably identify or treat a thyroid or blood sugar problem by guessing from symptoms alone. Number 6, a medication or substance may be affecting your energy. Some allergy medicines, sleep medicines, pain medicines, antidepressants, blood pressure medicines, and other drugs can cause sleepiness or fatigue. Alcohol may make you feel sleepy at first, but it can make your sleep lighter and more broken later in the night. Caffeine can create another cycle. You feel tired, so you drink more caffeine, then you sleep less effectively, wake up tired, and reach for caffeine again. If your fatigue began after starting a medication, changing a dose, or adding a new supplement, review the timeline. Do not suddenly stop a prescription medication on your own. Speak with your doctor or pharmacist. Sometimes the timing, dose, or medication can be adjusted safely. Number 7, your daily routine may be working against your energy. Irregular meals, too little fluid, too little movement, too much exercise without enough recovery, and an overloaded schedule can all contribute. The solution is not necessarily a perfect morning routine or an expensive energy supplement. Start with a simple 7-day energy audit. Write down when you go to sleep, when you wake up, what time you use caffeine, when you eat, how much you move, which medicines or supplements you take, and when your energy begins to drop. Patterns are easier to see on paper than they are in memory. Try to eat regular meals that include a useful source of protein and fiber. Drink fluids regularly, especially during hot weather or when you are physically active. Add light movement during the day, such as a short walk, if it is safe and appropriate for you. And be honest about recovery. If every hour is filled with work, caregiving, screens, training, or stress, your body may not need a new health hack. It may need a more realistic workload. So, what should you do first? Do not try to fix all 7 possible causes at once. Start with 3 steps. First, track your sleep and energy for 1 to 2 weeks. Second, review your medicines, caffeine, alcohol, meals, movement, and stress. Third, if the fatigue has lasted for weeks, is becoming worse, or is interfering with your normal life, schedule a medical appointment. A clinician may ask about your sleep, mood, daily habits, medical history, and medications. Depending on your situation, testing may look for anemia, thyroid problems, diabetes, infection, kidney or liver problems, and other medical conditions. Seek urgent medical care if severe fatigue appears with chest pain, serious trouble breathing, fainting, sudden confusion, or sudden weakness. Here's the main message. Feeling tired all the time is not a diagnosis. It is a signal. Sometimes that signal means you need more sleep, a steadier routine, or less late-day caffeine. Sometimes it points towards sleep apnea, depression, iron deficiency, thyroid disease, diabetes, a medication effect, or another condition that needs proper evaluation. The goal is not to cover up the signal with more stimulants. The goal is to understand why it is happening. If this video helped you understand fatigue more clearly, please like the video and subscribe to Health for Legacy. Your support helps us continue producing careful, deeply researched health content without hype or misleading promises. Thank you for watching it. We'll see you in the next one. Until then, live stronger, age better, stay safe, stay healthy, and take care.